Before today's episode, a quick message. This is Mark, and I'm the creator of Lantern Podcasts. I'm really looking to talk with more of our listeners to get a sense of what you honestly like and dislike about these shows. So if you'd like to chat, please shoot me an email at hello@lanternpodcasts.com, and I'd love to speak with each and every one of you. Thanks. Now on today's episode.
Africa CDC is on record today, pushing back on the very travel restrictions the U.S. just put in place. So now you've got two official public health bodies, opposite positions, same outbreak.
I'm Daniel, and if you've got a flight anywhere near this region, that disagreement is not abstract. It's your itinerary. This is Ebola Watch.
I'm Cassidy. Up next, the live Africa CDC DRC-Uganda coordination briefing. A virological preprint calling the Bulape outbreak a spillover from an unknown reservoir host. And a Philadelphia health advisory that's already 8 days behind the outbreak's current footprint. Here's Reuters.
We are supporting the government to conduct active surveillance and to start to understand all contact and to test them and to isolate them. We'll talk about it when I will share about what we are supporting, what we are providing to support the government.
The Africa CDC briefing finally put a number on the board. 1,771 suspected cases, 246 suspected deaths. And I want to slow down on that word suspected because it matters here. We've been waiting all week for a consolidated figure, and what they published is a suspected case denominator, not a confirmed one.
They also called it the second largest Ebola outbreak on record, which at least gives us an institutional citation for the deadliest framing we've been picking apart since Monday. But second largest by what measure, suspected or confirmed? Because that changes the comparison completely.
Exactly. And the briefing does make clear this is a regional outbreak by their own definition. DRC and Uganda, named together, joint coordination framing. What I'm watching for is whether Goma shows up anywhere in that structure, because one confirmed case in a city of more than 1 million on the Rwanda border is not a footnote.
And on countermeasures, if the briefing's vague about ongoing response actions and doesn't give a specific update on Bundibugyo targeted diagnostics or treatment options, that silence is the story. The Virological preprint this week says this spillover came from an unknown reservoir host, so the exposure pathway itself is still uncharacterized.
Here's Philadelphia Department of Public Health.
There are no suspected, probable, or confirmed Ebola cases related to this outbreak in the United States or anywhere outside of the DRC and Uganda. However, as a precaution, the CDC is raising awareness about this outbreak and sharing best practices.
The Philadelphia Department of Public Health HAN Advisory, message 04561A, dated May 21st, is still the active document moving through U.S. local health systems. That's 8 days old now, which means it predates Uganda's national emergency activation, the Goma confirmed case, and the Canada-Bahamas-Thailand travel restrictions.
And it's still relaying CDC's Level 1 for Uganda, Level 1, not Level 3. At a moment when the US has already moved to travel bans that Africa CDC is publicly calling counterproductive. A local health system the size of Philadelphia is working off a snapshot the federal posture has already lapped.
To be precise about what the advisory does get right, it names Bundibugyo virus specifically. It says there are 0 confirmed or suspected cases in the United States, and it gives clinicians a direct phone number to call. That operational plumbing is sound. What it can't do is tell a Philadelphia ER physician anything about the last week.
So the real question for local health departments right now isn't whether they got the memo, it's whether HAN updates are moving fast enough for this outbreak. 8 days here is not 8 days in a normal surveillance window.
NBC News, with Blanche Coors.
Kasai warned that isolating affected countries could undermine cooperation and weaken outbreak response efforts at a critical moment. Global health security cannot be achieved through borders alone, but through partnership, trust, science, and rapid investment in preparedness and response capacity, Kasai said.
The Africa CDC live briefing today is the institutional moment we've been waiting for all week. And the clearest signal out of it isn't a case count update. It's Dr. Jean Kasai going on record against the very travel restrictions the U.S. just put in place. That's two official public health bodies, publicly, on opposite sides of a policy question that affects real itineraries right now. Kasai's framing is careful. He says Africa CDC understands sovereign responsibility, but the substance is plain. Isolating affected countries right now risks undermining the cooperation you need to actually stop an outbreak. And that's not some abstract concern when the DRC-Uganda coordination framework is what's holding the joint response together. Here's Virological.
The Democratic Republic of the Congo, DRC, is currently facing concurrent outbreaks including Mpox, cholera, and malaria, 1 to 4. The Ministry of Public Health, DRC, has declared the 16th Ebola Virus Disease (EVD) outbreak on 4 September 2025, after PCR confirmation of Ebola virus (EBOV), formerly Zaire Ebola virus, in patient specimens from Bulape Health Zone in Kasai province.
The virological preprint on the Bulape outbreak uses a phrase that should stop anyone in this space cold. New spillover event from an unknown reservoir host. This is the 16th DRC Ebola outbreak, and the animal source, whatever started this, still hasn't been identified.
So when officials say containment, they mean containing the human chain. But the thing that lit the match is still out there, unidentified, in some animal population in Kasai province. That's a very different kind of open-ended risk than a broken contact chain.
And that sharpens the Bundibugyo R&D gap we've been tracking. If candidate vaccines were designed around a specific exposure pathway and the reservoir is still unknown, you don't actually know whether the pipeline you're building fits the threat you're facing. If you follow Ebola Watch for clear outbreak updates, try Hantavirus Watch. Daily updates on the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. You'll find links to all the stories we covered today in the show notes, so if anything stood out, take a few minutes to read more there. That's Ebola Watch for this Friday, May 29th. This is a Lantern podcast.